we're going to build on the Affordable Care Act. You know, before there was something called Obamacare, there was something called Hillary Care. And I really tried hard, and I got my head handed to me by the drug companies and the insurance companies. You know, I love it when all these other folks, including my opponent in the primary, talks about taking on the interest and that. Where were you? I mean, really, we were fighting tooth and nail trying to get universal health care coverage passed.
Linwood, Washington. Good evening.
Yes, I have three quick questions.
Okay.
If socialized medicine is so great, why do the wealthy of the world, including the Shah of Iran, come to America for treatment? Second question, will the last living socialist in the world be from Vermont? And third, was Adolf Hitler a socialist?
Thank you.
Well, let's start backwards and work our way up. No, I don't think Adolf Hitler was a socialist. He was a national socialist, a Nazi, and presumably, I suspect, arguably one of the more horrendous human beings that has ever walked on the face of this earth. In terms of socialized medicine, why rich people such as the Shah of Iran can go any place they want to get the best health care that they can. And I would say that probably in the United States, if you're a millionaire, this country provides you with the best health care in the world. Okay? If I were a millionaire and I were living in Iran or any place in the world, I might well come to the United States. The question is, what happens if I'm making $20,000 a year and I can't afford the cost of health care? Where would I go? Well, then I'd have a lot of problems in the United States. 15% of our people have no health insurance whatsoever. The cost of Blue Cross, Blue Shield is zooming up. Doctors' bills are zooming up. One of the interesting contrasts that one might work is not worry about Iran or the Shah, but talk about the difference between Canada and the United States. In Canada, when they do polls, they find out that over 90% of the people feel good about their health insurance program, health insurance system. You have a conservative government in Canada, conservative, right-wing government that comes in, does not attempt to change one part of that program because that government understands there'll be a revolt on the part of the people. You do a poll in the United States of America and you say to Americans, how are you feeling about the health care in the United States? People saying, it's off the wall. I can't afford it. I can't afford to go to the doctor. I can't afford it, insurance. And the polls tell us that the American people are grossly dissatisfied with what's going on. One of the things that I've done lately, if I may give an advertisement for myself, a brief one, is that at the last conference that I attended with the National League of Cities and Towns, we managed, with some other people, to push through a resolution on the part of the National League calling upon the Congress to develop a national health care system. I think that that's the way we have to go.